Welcome to this informative video about healthcare systems in the USA. Did you know the health insurance systems in the United States has caused a human rights crisis that deprives a large number of people of the health care they need? The most problem is that 32 million of people does not have health insurance, but the most distressing is the number of preventable deaths, up to 100,000 people per year. You will not believe this. 45,000 people die each year simply because they have no health insurance. Overall, the healthcare system is the result of the privatization of the commodifications of the United States, which reflects market imperatives and profit interests that devalue human needs, dignity, and equality. Here's a little overview. The United States healthcare system has both private insurance and public system that covers the elderly and low-income families. Employers sponsor private insurance is the main ways Americans receive insurance coverage, and most services are provided by private providers. Also, the Medicare program covers those over age of 65. Children whose families do not qualify for Medicare but don't make enough to purchase private health insurance are covered under the state Children's Health Insurance Program. Veterans are also covered under a separate program. Let's talk a little bit about the coverage. Nowadays, the United States is the only high-income country without nearly universal health care coverage. Attempts to achieve universal health coverage have been made since the 1940s, but apart from the development of Medicare and Medicaid, which provide coverage for the poor, near-poor residents, including children, pregnant women, parents, seniors, and individuals with disabilities. In 1965, little progress has been made for the implementation of the ACA. The ACA will not bring about universal coverage. It is expected that only about half of the residents who are currently uninsured will ultimately obtain insurance. Medicaid covers a broad range of services, including inpatient and outpatient hospital, physicians, and medication. Basic Medicare covers hospital services, but individuals can pay premiums to receive extra coverage for physician service and prescription drugs. The physicians must also agree to treat all Medicare patients for all services. A physician who does not accept assignment can be charged patients a price higher than the Medicare fee and accept patients on a case-by-case basis. Without assignment, a patient pays the actual physician charge and receives reimbursement for an 80% of Medicare fee. Under both Medicare and Medicaid, the physicians can choose to accept a segment of patients. If the physician accepts the segment, he or she agrees to accept the government-determined fee in full and cannot charge the patient an additional amount beyond the normal 20% copayment. Business can provide employer-based insurance, pay all or most of the premium, and employees pay the remainder. Patients pay a direct copayment to the provider, and cost-sharing provisions vary by the type of insurance. Self-employed or those who purchase private insurance on their own must pay premiums themselves. Financing. The United States government uses taxes money to reimburse providers who can care for patients with Medicare, Medicaid, SEHIP, and VA. The United States spends more than any other country on healthcare because it pays higher prices and has greater volume of services, particularly high-tech services, and it sort of lets high technology run rampant in the system. In comparison, The Organization for Economic Cooperation and Development is an international forum committed to global development that brings together 34 member countries to compare and discuss government policy in order to promote policies that will improve the economic and social well-being of people around the world. The OECD found that in 2013, the United States spent $8,000 per person, or 60.4% of its GDP, on healthcare, far higher than the OECD average of 8.9% per person. Following the United States were the Netherlands, which allocate 11.1% of its GDP, then Switzerland, also at 11.1%, and Sweden, which allocate 11% of its GDP to healthcare in 2013. In North America, Canada and Mexico spend respectively 20.2% and 6.2% of their GDP on healthcare. The OECD countries are generally advanced or emerging economies of the member states. The United States and Mexican governments play the smallest role in overall financing of healthcare. However, public spending on healthcare per capita in the United States is greater than all the other OECD countries except Norway and the Netherlands. USA, Canada, and Germany. Compared to the United States system, the Canadian system has lower costs, more services, universal access to healthcare without financial barriers, and superior health status. Part of the gaps between United States and Canadian healthcare costs may be explained by a failure to account for Canadian hospital capital costs, larger promotion of elderly in the United States, and higher level of spending on research and development in the United States. Canadians and Germans have longer life expectancies and lower infant mortality rates than do the United States residents. Finally, most Canadians and Germans think that their healthcare systems need minor to moderate changes, while in the United States, a substantial portion of the population thinks that large and fundamental changes are needed. Americans have been more dissatisfied with their healthcare system than the Canadians or the Germans have been with theirs. Many characterize the main gap in the American system as the problem of the uninsured, more than 40 million people, while this does not mean that they go entirely without care. The uninsured consume only half as much health care on average as the insured. Conclusion: the United States stands out as the country with the highest expenditures on health care. Americans would feel more satisfied with a national health insurance system or single-payer system, in which a single government entity acts as the administrator to collect all healthcare fees and pay out all the healthcare costs. A multi-payer health insurance system or an all-payer system which provides universal health insurance via sickness funds used to pay physicians and hospitals at uniform rates, thus eliminating the administrative cost of billing. Social factors, such as obesity, car accident, and homicide, should be considered the main reason for the difference between the US and other developed nations on general life expectancy and infant mortality, rather than the healthcare system structure or access. The large amount of money spent on health in the US has benefited the population in terms of research and innovation in equipment and procedures. The US healthcare system performs very well in terms of cardiac death scaffolding. Childhood leukemia has a high cure rate, 8 of the top 10 medical advances and selling medical drugs, and has some of the highest breast, colon, and prostate cancer survivance.